Hi everyone, myself Sornambiga in the Department of Microbiology at SNS College of Nursing. Today this session will explore the vital topic in the medical microbiology, that fungal infection, focusing on the two major pathogens, one is Aspergillus and Candida albicans. In that pathogens, we are going to see about, already I told, that Aspergillus and that Candida albicans. Moving on to the first topic, Aspergillus. It's a common mold found in the environment, in that soil, decaying vegetation and that household dust. Among the many species, Aspergillus fumigatus is the most frequently associated with a human disease. It predominantly affects the immunocompromised individual, such as those undergoing the immunotherapy, organ transplant, or uncontrolled diabetes. That Aspergillus can present in various chemical forms, that allergic bronchopulmonary aspergillosis seen in asthma and cystic fibrotic patients. That aspergilloma is a fungal ball pre-existing lungs cavities. Invasiveness of aspergillosis, a life-threatening infections, that particularly that immunocompromised patient, that are the host, and that symptoms can that cough, fever, hematospasmus, and chest pain, then respiratory distress. The diagnosis involve that combination of clinical evaluation, imaging, laboratory diagnosis, biopsy, CT scan and just, and galactoman antigen test, beta D glucan assay. These are the medical tests for these patients. Then culture and histopathology respiration secretion of the biopsies of the diagnosis. Then preventing. How we are prevent the aspergillosis. The prevent of the aspergillosis including minimize the exposure in high risk individual through the HEPA filters and avoiding construction of the sites. Then moving on to the treatment. The treatment is typically involved that antifungal agents such as amphotericin B. However, the treatment failure can occur due to the diagnosis resistance on patient whether that immunosuppressions. Now, we are the very treatment failure patients where will uh, cause that occasional skin rashes and elevated liver diseases. These are the antifungal aspergillosis where they work that poor hygiene technologies. Moving on to the candidiasis. Now, let's shift the focus on candida infection. The candida albicans is a part of normal flora but can turn the pathogen under the certain condition like prolonged antibiotic uses or diabetics, ICU admissions or use of catheters. It is the more common causes of hospital acquired fungal infection. And also the Candida albicans is a candidiasis is a HIV opportunistic infections. The Candida infection can range from the superficial systemic oral thrust. Then the vaginal candidiasis. That candidemia is a bloodstream infection that can lead the multi-organ failure. Then the common symptoms includes that patches of the mouth, then itching and system signs, liver functions and sepsis, invasive cases. Then diagnosis. Diagnosis of the test of this microscopy, gram staining, blood culture method, PCR and antigen test, prevention strategies like its catheter care, hygiene practices, and limiting the unnecessary antibiotic uses. Moving on to the treatment. The treatment is typically involved that fluconazole and ethinocandidiasis and amphotericin. These are the medications we are using for these type of patients. And we are using for the next step that candida. Overall that the candida is the infection that is include that candidiasis, yeast infection, brought that fungus. That candida that lives in the human body over the 20 different type of infections. Candida can cause infection but the most common in the lays of amount of presence in the small amount of body. Without causing harm, they can be found the places like our mouth and belly on skin. In the case of women, they can the vagina is a suitable environment can the yeast can outgrow and multiple uncontrollably causing the pain and inflammation. There are different type of candidiasis. The spread of the candida yeast in the mouth and throat lead to the condition is called thrush. It is a peritoneal candidiasis is the most common fungal infection in the mouth. It prevalent the people within weaken the immune system and conditions. that lead to the spread of immune system in the diabetic patient wherever that patient has cancer or HIV or AIDS. When the yeast spread, the genital, it refers to the genital yeast infections. Women are the most affected by the genital yeast infection than the men. The genital yeast infection affect the 3 out of 4 adult women in that yeast entered to the bloodstream and spread to the other part of body such as kidney, spleen, bones, muscles and also eyes is called invasive candidiasis cause number of factors, and that causes of candidiasis can increase the possibilities of yeast growing and out of the proportions that overdose of antibiotics and that pregnancy stress of the diabetes nutrition deficiency of cancers and treatment of HIV or AIDS, hormone replacement, therapy infertility or these treatment or the lack of sleep also may causes of the candidiasis. Symptoms of candidiasis is the thrush included redness, sore throat, mouth, thread, and the cracking of the corner in the mouth where swallowing, white or yellow patches, tongue, and the roof of the mouth, the inner cheek. These are the major part affected from the candidiasis. And then we are moving on to the diagnosis of candidiasis, where that majorly causing in that yeast infection by the way of human and women's in that during the period of urinations, and we are suffer from that. Next, moving on to the part and the doctor consultancy by the way of we can able to take the medicines, and in that main that the tip of the penis may red and swollen in the painful moment. By the way of doctor consulting, they are asking about the overall history of what we are taken from the past, and that we are collecting the sample from the patient by the way of skin scraping and nail scraping, scat scraping, and we can able to test like a KOH man preparation. After the candidiasis, the patient may feel like a weight loss, hygiene. These are the practices where they can able to take by the way of doctor advice. Next, moving on to the overall fungal infection. It is also known as the opportunity infection for HIV or AIDS. I hope this video will helpful for you. Thank you.